Welcome to Mount Sinai Hospital. The following presentation is an introduction to infection prevention and control. Today we will discuss infection prevention. Our objectives are that at the end of this session, you'll be able to describe the following. 1. Preventative measures utilized in daily practices to disrupt the transmission of infection. 2. Controls in place that are used to prevent exposure to blood and other potentially infectious material, including blood-borne pathogens. And 3. Your responsibility for maintaining personal health and safety. Our first topic is hand hygiene. Hand hygiene is the act of cleaning one's hands to remove microorganisms, dirt, or any unwanted substances that are stuck to the hands. We have two methods for cleaning hands: alcohol-based hand sanitizer and washing with soap and water. When you use alcohol-based hand sanitizer, make sure to rub with friction all over your hands, in between your fingers, and include the backs of your hands, and up until the wrists. Rub until your hands are dry. This usually takes about 15 seconds. When utilizing soap and water to clean your hands, make sure you use warm water. Apply soap and rub with friction all over your hands, covering all surfaces, for at least 20 seconds. Then, rinse your hands thoroughly with water. Dry your hands with a paper towel and use a paper towel to turn off the faucet. Please note, use soap and water if your hands are visibly soiled and when exiting the room of a patient who has infectious diarrhea like C. diff. Alcohol-based hand sanitizer can be used until your hands feel sticky. Then, wash with soap and water to remove the residue of the alcohol-based hand sanitizer. Clean hands are safe hands. We have many opportunities throughout our day to clean our hands, including before entering a patient room or contact area, before putting on gloves, and before touching a patient. We also have opportunities after exiting a patient room or care area, after removing our gloves, after touching a patient, and after our hands become visibly soiled or dirty. Are you wearing gloves? Please note, gloves are not a substitute for hand hygiene. We should always perform hand hygiene before putting on gloves and after removing gloves. At the Mount Sinai Hospital, we use the acronym CATCH, Close Attention to Clean Hands, as a safe, non-judgmental reminder to perform hand hygiene. If you see someone forget to clean their hands before entering a patient care area or after exiting a patient care area, simply say, CATCH. Another element of keeping our hands clean is ensuring we have clean nails. They should be less than a quarter inch long, and we should avoid chipped nail polish and artificial nails, as these are known to harbor more microorganisms than natural organisms on our hands, and these can be transmitted to other people. Our next topic is known as respiratory etiquette. These are infection prevention measures that are designed to limit the transmission of respiratory pathogens that are spread by droplet or airborne routes. More information can be found on the cdc.gov website. Achoo! Germs can spread easily within 3 to 6 feet when we cough or sneeze. When coughing or sneezing, please remember to cover your mouth and nose. Cover your mouth and nose with a tissue or sneeze into your upper sleeve. If you use a tissue, please dispose of it promptly. Then, wash your hands. Remember, if you are ill, please do not come to work. Stay home and prevent the spread of your germs to others. During influenza season, New York State requires that all healthcare workers are vaccinated for influenza. If they are not vaccinated for influenza, they must wear a mask within the hospital for the duration of the flu season, which usually lasts about 5 to 6 months. The Mount Sinai Health System offers influenza vaccines to all employees free of charge. When people have influenza, they may be contagious for up to 24 hours before they start to feel sick. People with influenza are a health risk to patients, staff, and visitors. Volunteers are also required to receive the seasonal influenza vaccine by October 1. Masking is now part of the universal standard for COVID-19 prevention. but it is not accepted in lieu of the influenza vaccine for our volunteers. Employee Health Services at Mount Sinai Hospital will provide influenza vaccine to volunteers who cannot receive it from a primary healthcare provider or school. The next topic that we will briefly discuss is called antibiotic stewardship. So what is antibiotic stewardship? Antibiotic stewardship is the coordinated efforts to promote the appropriate use of antibiotic and other anti-infective medications. At Mount Sinai Hospital, we have a program dedicated to promoting the appropriate use of antibiotics. We can all play a role in antibiotic stewardship. Improved antibiotic use can lead to improved patient outcomes, whereas inappropriate use can lead to the development of superbugs that can be resistant to available treatments. You should know that when antibiotic is prescribed, the course should be completed fully, even if you are already feeling better. We will now move on to our next topic, the Occupational Safety and Health Administration Standard, also referred to as OSHA. This standard regulates healthcare employers to provide a safe and healthy environment for its employees. Standard precautions are implemented for all situations in order to reduce the risk of transmission of blood-borne germs and other germs from recognized and unrecognized sources. Standard precautions include hand hygiene and the use of personal protective equipment, also referred to as PPE. Hand hygiene is one of the most effective methods to prevent transmission of germs. The use of PPE should be guided by your risk assessment of the situation and the extent that you anticipate contact with blood and body fluids. The standard precaution should be applied in all situations to protect you. As we mentioned, standard precautions are used for every patient every time. We assume all patients can have a germ that could spread to others. Utilizing standard precautions protects patients and healthcare workers. Here are some examples of personal protective equipment, otherwise known as PPE. Always use PPE when you anticipate a blood or body fluid exposure. Some examples include gloves if you anticipate contact with blood, body fluids, secretion, excretions, wound dressings, and non-intact skin or undiagnosed rashes. Always utilize a gown if your clothes or uniform may get soiled or splashed. Mask and eye protection also protects the mucous membranes of the face, eyes, nose, and mouth from sprays, splashes, and other droplets. The OSHA Blood-borne Pathogen Standard applies to all occupational exposures to blood or other potentially infectious materials. It requires annual training for all employees with potential exposure to blood and body fluids. You will learn more about how to protect yourself within your own departments. The exposure control plan is updated annually, and it is implemented to prevent occupational exposure to potentially infectious materials. It is available on the intranet in the Infection Prevention Manual, which is located on the Policies and Procedures website. To avoid exposure in the first place, use PPE and use safe work practices. The high-risk pathogens that we refer to in the OSHA Blood-borne Pathogen Standard are HIV, hepatitis B, and hepatitis C. The following are considered potentially infectious materials: blood, cerebrospinal fluid, pleural fluid, pericardial fluid, peritoneal fluid, amniotic fluid, synovial fluid, semen, vaginal secretions, any visibly bloody fluid, or unfixed tissue. Vomit, saliva, tears, sweat, urine, and feces are not considered infectious unless it is visibly contaminated with blood. Now, there are different routes of exposure. We have 3 routes. 1, parenteral. An example would be a needle stick, cut, abrasion, or bite. The second route is a mucous membrane, eyes, nose, or mouth. And the last one is non-intact skin. We will now discuss the blood-borne pathogens in a little more detail. If a person has an exposure to hepatitis B vaccine, there is a 30% risk of acquiring hepatitis B from a needle stick without prophylaxis. However, we have preventative measures. 1. Vaccination. We do have a vaccine for hepatitis B. The hepatitis B vaccine provides protection to 90% of recipients, and this is offered to all employees. Always use appropriate personal protective equipment and always implement safe work practices. In terms of post-exposure prophylaxis, our non-immune staff are offered hepatitis B virus immunoglobulin and vaccine. This offers about 75% protection from infection post-exposure. 95% of adults who get infected recover even without treatment. If a person has an exposure to hepatitis C virus through a needle stick, there is a 3% risk of acquiring hepatitis C. In terms of prevention measures, we do not have a vaccine for hepatitis C. However, as we've mentioned, always use appropriate personal protective equipment and always implement safe work practices. We do not have post-exposure prophylaxis. However, prompt treatment of acute hepatitis C infection can prevent developing a chronic infection. If a person has an exposure to HIV from a needle stick, there's a 0.3% risk of acquiring HIV from that needle stick. In terms of prevention, we do not have a vaccine for HIV. Always use appropriate personal protective equipment and always implement safe work practices. For post-exposure prophylaxis, antiretroviral medications are prescribed to prevent infection. This reduces risk of transmission up to 80%. It is more effective when taken as soon as possible after exposure. Our goal is to administer post-exposure prophylaxis within 2 hours of the exposure. So what should I do if I have a blood or body fluid exposure? Always stay calm. Wash the area. For percutaneous injuries, wash the area with soap and water. For a mucous membrane, always flush with water only. So what should I do if I have a blood or body fluid exposure? Always stay calm. Wash the area. For percutaneous injuries, wash the area with soap and water. For a mucous membrane, always flush with water only. Then report to your supervisor, who will help you fill out an incident report. After hours at Mount Sinai Hospital, notify the nursing administrator by dialing 0. Then report to Employee Health Services or to the emergency room closest to your work location immediately. The source patient should have lab tests sent for hepatitis B, hepatitis C, and HIV. But what if the patient cannot consent for an HIV test? You should know that New York State allows for anonymous HIV testing in cases where the source is deceased, comatose, or otherwise unable to provide consent. The results of an anonymous test, but not the identity of the source, are disclosed to the exposed person's provider. The results of the source HIV test is not disclosed to the source or placed in the source person's medical record. So again, if you are exposed and we cannot get consent for an HIV test, we can test anonymously, and we will be able to understand the person's status and use that information in terms of how we treat you. So how can we eliminate sharps injuries? Be prepared, be aware, and dispose with care. As you are not providing clinical care, we will focus on being aware of your environment and your surroundings. Be aware of your environment and of the people around you. If you see a sharp, like a needle or a blade, in a clinical space or any area where you are, please notify your nurse and ask them to dispose of it properly. If you see something, please don't hesitate to say something. On this slide, we have a number of engineering controls that the Mount Sinai Hospital has in place to prevent a blood or body fluid exposure. We have designated sharps containers, which you'll come to familiarize yourself with as you see them in every patient room. We have labeled specimen bags. We have regulated medical waste containers, which are noted with a medical waste biohazard sign. We have specific safety syringes and needles to protect our staff. We have needleless connectors or IV tubing also to protect our staff, and mechanical pipettes in the lab. Another example of safe sharps at Mount Sinai Hospital, the image on the left is a safety injection needle with a thumb closure. The image on the right is a safety scalpel with a thumb closure. To note, we always use one needle, one syringe, one time. We cannot keep needles or syringes to use them again. From the one needle, one syringe, only one time campaign, there are 3 things that every provider needs to know about injection safety. 1, needles and syringes are single-use devices. They should not be used for more than one patient or be used to draw up additional medication. 2, do not administer medications from a single dose vial or IV bag to multiple patients. And 3, limit the use of multi-dose vials and dedicate them to a single patient whenever possible. We will now spend some time discussing transmission-based precautions, the method in which organisms, germs, bacteria, viruses are spread from one person to another. As you will be volunteering at the hospital, you should know that there are reasons we put patients on precautions. We use transmission-based precautions to prevent the transmission of microorganisms, bacteria, and viruses from a colonized or infected patient to other patients, visitors, and healthcare workers. There are 3 main categories of transmission-based precautions based on the mode of transmission and the personal protective equipment, or PPE, that we need to prevent transmission from person to person. Contact precautions, droplet precautions, and airborne precautions. These are all used in addition to standard precautions that we discussed earlier, which include, if you recall, hand hygiene and the use of personal protective equipment. So, for our volunteers, always watch for signs. A sign is placed on the door to the patient's room to designate that transmission-based precautions are in place. Volunteers may only visit patients with permission from nursing. If there is a transmission-based precaution sign posted, volunteers must first report to the primary nurse to discuss permission to enter and the hand hygiene and PPE requirements. As a general rule, volunteers may not enter rooms that are designated as special contact precautions, special droplet precautions, airborne precautions, and aerosol generating procedure in progress. Let's start with contact precautions. A patient is placed on contact precautions because they are colonized or infected with an organism, usually a multi-drug resistant bacteria, which is on their skin or in their gastrointestinal tract. The patient is placed in a private room. We wear gloves and gowns to prevent transmission from the patient or the patient's environment to another patient. You'll see an example of a contact precaution signs noted on your right. Next is special contact precautions. Clostridioides difficile, also known as C. diff, can be spread through spores that are resistant to alcohol-based hand rub and that can persist in the patient's environment. Therefore, after removing your gown and gloves, please remember to wash your hands with soap and water. Always use dedicated patient equipment and clean the environment and any shared equipment while using bleach. Norovirus, sapovirus, and Candida auris also require special contact precautions. You can see a visualization of the sign on your right. Moving on to droplet precautions. Droplet precautions are used for diseases where germs are spread by large particles caused by coughing or sneezing. These particles usually settle within 3 to 6 feet from the patients. We wear a surgical mask when caring for patients on droplet precautions. Preferentially placed in private rooms, but do not require negative pressure. Possible or confirmed influenza requires droplet precautions. This is an example of our droplet precaution design. Airborne precautions are different than droplet precautions. Airborne precautions are required for diseases that can be spread by very small particles, about 5 microns, that can remain suspended in the air. We wear a respirator and a N95 or a PAPR when caring for these patients. We must be fit tested and know what type of mask that fits our face. That said, this is why we do not have our volunteers enter our airborne precautions rooms, because our volunteers have not undergone fit testing. Patients should be in a single patient room with negative pressure. Examples of diseases that require airborne precautions include tuberculosis, measles, and disseminated varicella, also known as chickenpox. For our patients who have varicella, we do require that they are on both contact precautions and airborne precautions. They should be in a single patient room with negative pressure. We wear an N95 respirator or PAPR and gown and gloves to be in compliance with both airborne precautions and contact precautions when caring for this patient. Again, any patient with the blue airborne precaution sign, we must be sure that we know which mask we should wear and that we have been recently fit tested to ensure that the mask fits our face properly. Now let's talk about precautions for COVID-19. For COVID-19, we combine 2 methods of transmission-based precautions: contact precautions and what we call special droplet precautions. These are used for patients with a confirmed lab result that is positive for COVID-19 and for a person or patient who was under investigation, which we will refer to as a PUI, for COVID-19. These patients should be in a single room. Negative pressure of the room is not required unless the patient is undergoing frequent aerosol generating procedures. We do wear an N95 respirator or a PAPR, eye protection, which could be a face shield, safety glasses, or goggles, and gown and gloves when you care for this patient. That said, all of our staff who are caring for COVID or PUI COVID patients must be fit tested so that they know that they are wearing the correct N95 respirator. One of the signs you might see while on the units is a purple sign titled Aerosol Generating Procedure in Progress. We sometimes abbreviate this as an AGP. For anyone entering the room who is a staff member, they must wear an N95 respirator and eye protection. This sign is used for all patients, even those without COVID symptoms and those who may have tested negative. You may be wondering, as a volunteer, which rooms am I allowed to enter? So we will say it here. Volunteers may enter rooms with patients with signs posted for contact precautions and those with droplet precautions. We ask that volunteers do not enter rooms with these signs posted: special contact precautions, special droplet precautions, airborne precautions, and aerosol generating procedure in progress. This is to keep you safe. You may be wondering, what other precautions or preventative measures do we have in place to prevent COVID-19 transmission? Firstly, we ask that all volunteers perform a daily symptom check, including temperature, prior to reporting to work. Please social distance as much as possible, even among coworkers. As always, we are advocating for frequent hand hygiene. And as you know, universal masking. All people who enter Mount Sinai Health System must wear a surgical mask. Our inpatients may not be able to remain masked for the duration of their hospitalization, but they should definitely be masked during transport and ventilating in the hallway. And we ask that you also remind our patients to please stay masked as much as possible. For you, every time you're having an encounter with a patient, please wear a surgical mask and eye protection. The eye protection is an added preventative measure to prevent inadvertent exposure. Lastly, as you may have heard, the COVID-19 vaccine is mandated for all employees and volunteers. Our final topic of discussion is cleaning, disinfection, and sterilization of equipment. So what is clean? Cleaning is the act of removing visible debris. Disinfection is removing bacteria and viruses. This includes both low-level and high-level disinfection. Lastly, sterilization is the act of eliminating and destroying all microbes. Now we will review some of the products we have in our facility to disinfect reusable items in between patients. For low-level disinfection, we have a product known as hydrogen peroxide that is used to disinfect reusable items between patients, including blood pressure cuffs, pulse oximeters, stethoscopes, stretchers, and exam tables. These are all items that you will see during your volunteer rounds. The contact time, or wet time, or the time it takes for this product to work is 1 minute. You will also see a bleach product. This is used to disinfect items that are in contact with blood, or patients who have Clostridioides difficile, also referred to as C. diff, or norovirus. The contact time, or wet time, or time it takes to work, is 3 minutes. That means the item should be in contact with the solution for 3 minutes before it dries in order to have adequate disinfection. In order to meet the increase in demand of disinfectant products when the COVID-19 pandemic hit, we did allow for alternative products, as you'll see here in this photo. Ideally, we will go back to our standard products, the green hydrogen peroxide and the blue bleach product. But note, if you do see these alternative products, they are okay to use, and please be familiar with the contact time, which is noted on the canister. In summation, our medical equipment should be disinfected after each use. As we talked about in the previous slides, the contact time is the time that the item should be wet with the disinfectant solution for that period, and it should be noted on the product label. Always wear gloves while disinfecting. This is to protect you from the chemicals and from the debris that is on the items that you are trying to disinfect. Remove your gloves and perform hand hygiene after completing the disinfecting process. This concludes our introduction to infection prevention at the Mount Sinai Hospital. For more information, the infection prevention team can be reached at 212-659-9450. You can also email us at #infectionprevention@mountsinai.org. My name is Talia, and I thank you for joining us today. Good luck in your volunteer journey. Always remember that infection prevention is in your hands. Clean hands save lives. Thank you.